All right, we are live. Everybody, welcome. This is Dr. Michael Kaye from the Center for Functional Health. And tonight I am honored to have as my guest Eva Minkoff. She is the host of Humancare Podcast. Eva and I had a chance to speak a few months ago and hit it off. And we got to talk about things I like to talk about, and that's helping people. We talked about chronic pain. So Eva, welcome. I'm so much looking forward to hearing what you're going to share tonight. Again, I had the opportunity to watch your TED Talk, which I absolutely loved. Just the beginning of it just sucked me right in. Didn't know where you were going. And you know what? It was a great ride. So welcome. It's so good to have you tonight.
Oh, thank you so much, Michael. Really, I always appreciate anyone who watched my TED Talk, first of all, and especially if they liked it. So it's always good to hear, but very much an honor to be on the show with you too.
Great. Thank you. So if you can share with the listeners, a little bit about your background.
Sure. Well, you said you love talking about helping people and chronic pain, so definitely fits in my bucket. First of all, I'm on a yoga ball, which I'll tell you. So that's one, why I'm moving. But the reason that is relevant is because I have been a chronic patient for like at least 20 years now, I'd say. Started seeing specialists at age 12, wasn't diagnosed with anything until age 20. And I wasn't really properly diagnosed actually until this summer with Ehlers-Danlos syndrome. I also have fibromyalgia and mast cell activation syndrome. So basically, I am the Tin Man and Gumby in one. So it's great. I've been experiencing those my whole life. A lot of which not only went undiagnosed, but I was misunderstood, unheard. I went to, I don't even know how many doctors. And even if they were the nicest doctors or the best doctors, Park Ave, I lived in New York City. So Park Avenue, top docs, right?
Right.
It didn't matter. I wasn't able to establish a relationship or a rapport with most of them. And I didn't really understand that. I didn't understand how it could be so clear to me what I was experiencing. And yet my doctors couldn't diagnose me. Or even if they couldn't diagnose me, they couldn't understand me. And I didn't understand why that was. Because I'm an empath.
Why don't you explain what an empath is, though?
Oh, what is an empath? Ooh, I don't normally have to define this, but empathy is when you're able to see from another person's perspective. It doesn't mean that you actually understand their perspective, but you are trying to understand their emotions. So something that my husband says, and I may even mention this again later, is in regards to my pain, I understand that I don't understand. And that in itself is understanding, and that is empathy. So he understands and feels that I'm struggling, even though he can't understand my pain. But it's remarkable how few doctors said that or something like that to me. They couldn't see it, or they couldn't see from my perspective, so they wouldn't validate it.
So discount it.
Yeah. And all of this really came to light when I was a teenage girl who was a ballerina. And therefore, and I understand why to an extent, but I was a drama queen and, making a bunch of noise about something that wasn't really happening because it was an invisible illness.
It was a great interview with another person who was also a dancer. And it was a 2-part podcast interview. And that was,
Stephanie.
That was really something. That was a great interview. I mean, I think, and we see it in practice now, it still happens where chronic pain patients get lumped into a category, right? So you have chronic pain. A lot of people think drug seekers. Chronic pain, therefore, must be in your head. I mean, this is the thing that we still see. And, when somebody comes to the office, we want to kind of step out above that. Because chronic pain of anything is still chronic pain. I had a lot of patients who had fibromyalgia who would say when they went to a new doctor, they would never say they had fibromyalgia because they feared that they were going to be lumped into a category and not be heard. So how many times do you think in your life were you not heard?
I've never counted, but if we're talking not just health professionals, but also just people in my life, probably like everyone at some point.
It's hard, right? That's hard to deal with, especially when there's a relationship, right? A loved one, a best friend, and they're not paying attention or understanding. What do you say to somebody who's in chronic pain and then their friend or the relative doesn't get them, or the one that drives me a little crazy? You just got to get over it.
Yeah. Right. And I'm all for certain kinds of tough love, by the way. Like, it's not always a bad thing, but in order for a person to support another with their pain in any capacity, you first have to validate what they're feeling. Like, that is just number one. That is respect for that person, that they are telling the truth. Like, I say I'm in pain. Yeah, you can't see anything. The doctor can't see anything. But do you trust me that I'm telling you what I'm actually experiencing? So, yeah, so I'm not actually sure if that was a question or not, but that's something I felt the need to say.
So, this, your presentation, your clinical presentation, the way you feel, the way you felt for many years has now brought you to this point, this present time, where now you act as an advocate to help others. So can you share about the Humancare Podcast? I mean, I've been listening to the podcast, so I enjoy them, but can you share why you developed it, why you felt there was a need to develop it?
Sure, absolutely. Well, first of all, I want to give credit where credit's due. That before I started the Humancare Podcast, I was the co-host of Invisible Not Broken, which I actually still am the co-host of Invisible Not Broken, which is a podcast about people with chronic illness and disabilities, where we would share our stories, me and my co-host Monica. And from there, I found that pretty much all of my episodes included some sort of focus, whether I meant to or not, on the relationships along our healthcare journey, whether it be with our doctors or our family members or caregivers, and actually, to add to that, ourselves. I always touched on the relationship to self on our healthcare journey, because it's the most important relationship. And since I found myself really honing in on that topic, around the time I decided I wanted to do a TED Talk, actually, I decided to launch the Humancare Podcast. And Humancare is actually, I'll give one little spoiler of my TED Talk. It ended up being the last line, or one of the last lines. I mentioned Humancare, and that was before I decided to make it the podcast name. It resonated with me, not just when I wrote it, but it resonated with me in the moment when I was on stage. And I was like, you know what? That is the name. That is the name that I am going to use for my podcast, because I want to talk about this all the time, not just on this stage.
So how do you see it now? When you look at 20 years in chronic pain, do you see that it's different now? The doctoring aspect of things are different now for patients with chronic pain?
Ooh, that's a good question. In some ways, not at all. And in some ways, very much so. First of all, there are a lot more functional medicine doctors and doctors that spend more time with their patients. So in that way, there's a really big difference, because there are more doctors that will spend the time with you and actually understand that you need to look at a person as a whole. Thank God for people like you. So that's changed. But in some ways, standard medical care has not changed. And in other ways, it might have even gotten worse, I think. And we spend even less time. Doctors often need to spend even less time with their patients. Everything's a lot more like check off boxes and financially focused rather than patient focused. Like, it's really quite remarkable that in the tech world of healthcare, which I've spent years in, it's special if you say you're patient centric.
Right. Weren't you always?
Well, I'm sorry. What were you before?
Right. Weren't you always?
Yeah. So I'm like, oh wow, that's it's not good that you get to brag about being patient centric.
Right.
Yeah. Now, this is something I do in the talk and something I do in the podcast, and I will do forever. I do not just advocate on the patient side, because in any relationship, it takes two to tango. And both people are equally responsible for the relationship. And so you got to think about it from the doctor's perspective too. I can't give an exact number, nor do I really want to give an exact number, but physician suicide is the highest it's ever been.
And it's increasing. It's not going in the opposite direction, right? The burnout is humongous.
It's outrageous. And on top of it all, doctors are also being compensated less if they're choosing not to do a specialty that is lucrative. So pediatricians, oh my gosh, like if you want to help children, good luck paying off your medical school bills. Really, right. It's very difficult. And general physicians, which we need more of, and people are not seeing, and I can go on a tangent about that. They're paid incredibly low. Like it's really, everyone thinks that doctors, look, every doctor in different specialties, especially if they're on their own, they can make different livings, but doctors do not go through medical school and residency and maybe fellowship because they're looking to make bank. That is not like, and it really bothers me when people shy away from functional medicine doctors or integrative doctors or people who have their own practices because they think it's all about money and they're greedy. Like I hear that all the time, and I hope I'm not saying anything out of line, but I ran Wellacopia, which was primarily integrative and functional medicine physicians. And people would say all the time, well, like, I can't afford that. And it's like, there was this just huge disconnect in our healthcare system when it comes to value. Like we were told that, oh, if it's a $20 copay, that's the value of that doctor's time and of my health. And it really drives me crazy. Now I understand, like, that doesn't mean it's not difficult to be able to afford the right care sometimes, but it's about priorities. And sorry, where I was going with this is they would talk about how I don't want to see that doctor because they're greedy. You know, they're making me spend more than I need to spend. I'm like, in actual fact, they're probably charging a hell of a lot less than the insurance companies are. And they're doing this so that they can spend more time with you, that they can give you the comprehensive care that you need. Because they can't keep their practices alive if they don't. And then they can't help you. Sorry, going on a little bit of a tangent there, but people do not understand the doctor's perspective at all.
Correct. And we say it all the time. And, you know, and I say to patients, you know, the doctor that you're seeing at the hospital is not the one who's creating the bill. You know, the doctor works for a corporation. I mean, you call it what you want. The hospital is a corporation. It serves a wonderful purpose. I think they're absolutely amazing people. But at the end of the day, if the beds are not full, if the census is low, if procedures aren't being performed, money's not being made. And often the doctors would like to do additional work, but they're handcuffed. They can't.
Yeah.
You know, so, you know, I come to the support of the doctor just like you do. And patients often are frustrated that they feel they're, you know, being charged too much. But I mean, the docs I know that work at a hospital, they're not the one coming up with the fees. I mean, it's not them. They're just going to work.
Yeah.
They want to do their best. So I do find it interesting. And, you know, and that really leads to like reviews of doctors online. And I don't know if you've experienced this, but I had a patient who said, well, his doctor only has a 3.5. I'm like, well, let's go take a look at what's being reviewed. And 90% of the time, somebody's upset about a bill.
Yeah.
That automatically brought that Google rating down, and therefore that doc suffers. But the doc is a great doc.
Or the staff. It's like maybe
the staff
is rude, and then they have to, because there's no better ways to rank. And even now there are certain apps or opportunities to rank doctors on multiple things, which I'm glad that's finally happening. And even so, this is my little pet peeve, they will rank bedside manner as like a thing in totality, when bedside manner is not a one size fits all.
Correct.
People have a very different idea of what good bedside manner is. Sure, it's good to have someone that's just generally nice, right? Like, I don't think anyone's really going to complain about a nice human. But otherwise, whether or not someone is straightforward or coddles you or like speaks to you like you're a doctor, and therefore it's like, oh, you think highly of me, or it's you don't understand me. Everyone has a different idea, different expectations about what good bedside manner is. So you still have discrepancies there when someone ranks it as well. That happens all the time. And something that I'm actually surprised I haven't said yet, because I say this usually off the bat and I repeat it all the time, is doctor-patient relationships are just relationships between humans. And the best way to think about, and you can carry this outside of healthcare too, of course, but if you want to know how to handle a doctor relationship or a patient relationship, how would you handle it if it was another person, if it was your loved one, a friend, a colleague, someone on the street even? What is something that, how can you guys get on the same level? How can you show empathy? So in this instance, let's say we have a doctor and a patient that are not seeing eye to eye in the slightest. And like they're just, the bedside manner expectations are very off. If a patient understands that that doctor is doing their best, even if like it's not what they want, if they're like, oh, this doctor is like being way too cold, analytical, and it's just not what I want. If they recognize that they're trying to do their best, like that's their style, they can take down their guard and advocate for themselves. This is an option. Like you can advocate for yourself and like, hey, can we take a little slower? Like, can you explain to me differently? Or I really like, this is feeling a little uncomfortable. If you recognize that that person is not lashing out at you and not trying to do something a negative towards you, you understand them as a person, speak to them like a person and try and see where you can connect. Same with the doctor. If the doctor feels like a patient's being really defensive or being like, Dr. Google said this, right?
I bet today.
Right? Yeah. That happens all the time. I completely understand doctors' frustrations. I hear it all the time. My husband's a doctor, so I hear these things. And that doctor can be like, all right, look, I want to find the best way to manage your pain, heal you, whatever it is. You and I are on the same team. What can I do to bring you ease at this moment? Or what is it that you really want to hear? What is it that you, in a non offensive way, what is it you want from me? Right? Like let's get on the same page here. At the very least, validating their experience. I can't stress that enough. All doctors out there, just validate what the person's experiencing, even if you do not understand it in the slightest. Just please do that, please.
Right. Right. I think that's really important. I mean, I remember I had a patient who I seen, she was really just in very bad acute lumbar pain. And we're done the exam and I bend down and I tie her shoes for her. And she's like, you're the only doctor that ever tied my shoes for me. Why did you do that? I said, well, two reasons. One, you can't bend down and tie yours. And two, my wife had to help me tie my shoes one day because of my low back pain. So, you know, again, we're just all human, right? I mean, fair is fair. I mean, I got help this morning. I helped her in the afternoon. So that's the way it's supposed to go. You know, that pain is one of those characteristics that makes us all equal.
Yeah, it really does. It is an equalizer. Can I bring up something, if you don't mind? I'm big on playing devil's advocate, not because I have an opinion one way or the other, but just because I like to see what comes from it. It is totally possible, and I know people that this would be possible for, where if you tied their shoe, they would be so angry because they'd be like, that's you telling me that I'm not capable of doing something. So it's just a really good example of you doing something that you thought was helpful and kind and compassionate that someone could take another way.
Correct.
This was if you are both people in this instance that are in the, I don't know, Humancare mindset. I don't have a label for it yet, but are basically in an empathic mindset. That patient, let's say that patient did not like what you did. They could be like, I understand that you're trying to be helpful, but it's okay. Like, I got this and I want to be able to do it myself, rather than being pissed off at you. How dare this guy do this? And this is what he thinks about me. And you could also say, maybe it could have been that you asked ahead of time. That could have been something. Or afterwards, if you saw the reaction, be like, I'm very sorry. This is, I thought that would be nice, but I didn't read the situation correctly. Right? It's just balancing it out.
Right. So, it's one of those things where it's in the moment, right? And you can see where she was and where she couldn't get you physically. And I was there and she's like, thank you. It's an act of caring.
Yeah. No, I mean, I love what you did.
Yeah, I mean, it's just, again, rich, poor, regardless of your background, when your disc goes out on you, you're down. You're down for the count. Listen, when you have a flare, right? When you get a fibro flare, it really, nothing else matters other than you, right? It doesn't matter where you're from, how much money you make, you're in a fibro flare, right? So
yeah, I'm a very, very strong person who becomes very weak all of a sudden. I got guns.
Right. So, that's the other thing. When it's hard, I mean, especially for me, to ask for help. It's okay for somebody to ask help from me, but when I'm down to ask for help, that's hard. So asking for help, especially in the male mindset, is very difficult. And we see that a lot. And we see a lot of men who won't ask for help.
Oh, yeah, for sure. I mean, the fact that most chronic illness advocates are women by far. I mean, it's probably like a 8 out of 10. That's pretty much
not 9 out of 10, right? I mean,
yeah, honestly, it really is. What's really interesting is that it's an example of groupthink and how or trends, like if enough people have said it's okay, then they're okay with it. So an example being Crohn's. Oddly enough, Crohn's or an IBD, I mean, it's a pretty intense condition, really, and can be very much life-threatening. There are variations, but we're talking about your stomach badly mistreating you, and people who have it like to make light of it by calling it like the poop disorder, right? Oddly enough, my husband's a pediatric gastroenterologist, so we talk about that stuff a lot. But Crohn's has now come up in so many discussions around men that I have found it to be so much less taboo these days for men to talk about having Crohn's. Of all the conditions, that is one men don't seem to be as scared to talk about anymore, just because enough people spoke up about it.
Right.
I just find it fascinating because you don't have that coming out with fibro in men.
No.
And there are millions of men that have fibro who either don't talk about it or don't know they have it because they can't be bothered to go check or admit it to themselves. But now enough people have talked about Crohn's that they're like, oh, I'm good with this diagnosis. I want to get treatment and I want to be helped. And that is both a good thing and I'm also annoyed at the same time, right? It just happened to be with Crohn's, but not these other conditions.
Right.
Yeah.
So the Humancare Podcast, again, has taken off. It's, I really enjoy it. And now you have another venture that's on your table. So can we talk about that?
Yes, it is very early. So I apologize for anything that ends up maybe changing in the future. But I was recently, actually, this is relevant to something that happened today on the Humancare Podcast. I released this episode where I interviewed Clorinda Wally. Went out this morning, Tuesday morning. And she is the CEO of the charity Good Days. And Good Days is a medical copay reimbursement program. And they have helped millions of people for the last, I think, 17 years, I forgot how many years, pay off really outrageous medical bills or copays. So if you have cancer or any kind of cancer and you have chemotherapy and your insurance pays for it, but doesn't pay $20,000 of it, they pay the $20,000 for you. So obviously a big fan of the charity. And I'm saying this, I said this on the podcast, I would say this anyway, but Clorinda is, she's just a powerhouse and someone with actually IBD herself, as well as many other conditions. And I'm saying all this because I respect Good Days and I respect Clorinda. And apparently that shined through because Clorinda a couple months ago asked me to launch the advocacy branch of Good Days. And this advocacy branch, name still TBD, is going to be an extension and expansion of the Humancare Podcast. So right now, the Humancare Podcast is part of the Invisible Not Broken podcast network, which I also started with Monica, and we have a few podcasts under that right now. But now we're actually going to be moving those podcasts over to this new advocacy branch and expanding with podcast videos and blogs that all focus on the human care theory, I guess you could say, which is that relationships are the solution to all the problems that we have in healthcare. So if we're talking financial problems, legal problems or political issues, racial biases and lack of access to care and awareness, all of these things at the end of the day boil down to relationships. Doesn't mean that there aren't other issues. I'm just saying, like, my theory is that if we approach this from relationships first, that the ripple effect of solutions will come. And so this advocacy branch, again, name I don't know, will host all of these different subcategories of podcasts. So we have one called Sex and Chronic Illness. So that's about, physical and romantic relationships related to the world of chronic illness between loved ones. And then we will have a podcast related to the caregiver experience, both like what it's like to be a caregiver, their internal experiences, and then also how to care give. We're going to have a podcast on minority health, on youth health, on health in the workplace, all of which what they have in common is the theme of relationships. So it's going to be, I'm just ecstatic, because if you have heard any of this, if you see my TED Talk, you'll see that this is what I live for. This is my mission in life, is to humanize healthcare through relationships. And I was recently given the dream opportunity to build that out.
That's fantastic. Congratulations again on that. I think that's absolutely wonderful. I think I always tell patients, especially when they've been diagnosed with an illness and they're going to go see the second doctor, to bring an advocate with them, because a lot of times patients are out there alone. And I can tell you, having the experience of handing somebody very bad news, I remember saying to one individual, I'm going to tell you something. After I tell you this, you're not going to hear anything I say afterwards. And that's okay. When you get home, just have your wife call me and we'll both get on the phone again. I think it's so important that there's an advocate there, someone to help somebody, especially when they're dealing with any type of chronic illness. Because sometimes we don't hear, right? The doc might want to say one thing, but we hear something completely different. So I think having that advocate is important. That relationship is important. Mm-hmm. What can we say to an individual? I mean, both you and I agree that our system is compromised. Our healthcare system is compromised. So you talked a little bit about, if you're going to speak with your doctor, you don't like what your doctor is saying, kind of reframe things and bring him or her back to your thought process and share. I tell people, you don't like your doctor, fire them.
Yeah.
Hear it.
We're also allowed to do that, just like you do in the real world.
Yeah. It's okay to fire your doctor. He takes my insurance, she takes my insurance. There's many other doctors that take your insurance as well, right? You don't like it? Fire that doctor. But what can we say to the patient? How can we best navigate in this healthcare world, this sick care world, this insurance world? How can they take better care of their health?
Take better care of their health. Well, there's so many ways to take better care of your health, but when it comes to
that aspect and working within that system, because sometimes you're stuck. You don't have the opportunity maybe to see somebody outside, of what your insurance does. So, an insurance coverage. So what can we tell that person who has to stay within that system?
Yeah, that's a really good question, because I like to think about the challenges. Sure, it would be great if we had more time. Sure, it'd be great if we could find any doctor we wanted out there. But sometimes you don't have the time. And sometimes you have this one doctor that you can see. So within those limitations, what can you do? And as we were saying before, remember, in advocating for yourself does not mean yelling at the doctor. It does not mean putting up a front and be like, listen to me. That's not going to work either. And you know why it's not going to work? If you did that with like your husband or wife or your best friend, would it work? No.
Right.
Maybe for some, but usually they're going to shut down. They're going to be on the defense.
Yes.
So advocating for yourself, sure, it means speak up, but it does not mean come at someone. It means I'm going to speak up and let's do this together. It is a partnership. And that's why I always say it till like I'm blue in the face. Doctor-patient relationships are just human relationships. So what would you do if this was a friend or a loved one or even a stranger, truly even a stranger, which I guess a doctor pretty much is a lot of the time if you haven't, especially if you don't know them yet. How would you get them to listen to you? And to get them to listen to you, first of all, vulnerability begets vulnerability.
Mm-hmm.
So that is something I do tend to preach. And I know it's difficult, but if you are open about how you are feeling, you can't invalidate someone's feelings. If you say, I feel scared, what is the doctor going to say? No, you don't. Like, right? Like that's an easy thing that they can't invalidate is your feelings. And if they do, then you really should leave.
Like, immediately.
Like, okay, you know what's going on in my brain right now? Right. But I would say a step one is actually to advocate for yourself by speaking up about how you are feeling and what you are experiencing. Like these are truths. These are not opinions. This is what's happening to me right now. So that will usually, I would say almost always, get a doctor to see something differently. Be like, oh, well, tell me more about that. Why are you feeling scared right now? And then you have the floor to speak up about what's going on. Maybe when a doctor was sort of just going off their list and checking off what you do or do not likely have. Which again, I'm going to give the doctor some credit. I understand there's a lot of time, there's a lot of pressure. They're diagnosticians. I get it. But you gotta find a way to connect with that person. Barking at them isn't going to work. So if you are vulnerable, if you are open about who you are and what you're experiencing, and sometimes it may require a little bit like, hey, this is important. Sometimes you may need to do a little bit of that. Then that person is going to engage with you as a person. Show them that you are a person and not just someone on a chart, like a list of things on a chart.
Right.
And respect the fact that they are not just like a person in a lab coat who doesn't have any emotions or a life of their own. If you ever need a little boost when a doctor's being an ass or something like that, if you're with a doctor who's just not treating you nicely and you're really not in whatever, like you feel like you can't find a way out, you can't get them to get on your level, if you're really in that situation, then it's time to take the responsibility on yourself of being empathetic. And that means understanding that this doctor is whatever they're doing, they think is the right thing to do. They do mean well. They are trying to help you. They are trying to do what's right by their career. Also, there's a lot of things going on in their mind. They may not be doing it in the way that you like and maybe a way that you detest, but they are at baseline a good human being who's trying to do the right thing. And so maybe you don't want to see them again, or maybe you try and block out all the noise and take them for what it is they are useful for. Like maybe it is the medication, maybe it's the diagnosis, maybe it's like, what can I get from this interaction? It may not be liking this other human.
Right. That happens, right? I mean, sometimes the personalities just don't click, right?
Yeah.
So I mean, if you look at the studies where somebody's very confident in their surgeon, and they're very happy with their surgeon, and they have a good relationship with the surgical outcome is usually much better.
Yeah.
Plain and simple.
So what was I going to say on the, so in this situation, if you can't work the relationship, if you guys can't work together, it is still helpful for you as an individual, as a patient, to be empathetic towards them, because, I mean, quite frankly, what does it do for you to be angry?
Nothing.
Doesn't help. You being angry at this doctor that isn't going to change, right, doesn't do anything. You might as well walk out of there, sure, a little disappointed, absolutely, but think to yourself, I did not get what I wanted from that appointment. That doctor and I did not connect. I know he was trying his best, but it wasn't right for me. And that's so much better than coming out of that appointment enraged or devastated or feeling like I did, which was invalidated. Look, if I knew what I knew now, back then, I know there's one doctor in particular who I thought was very nice, but he just didn't get me. I was a professionally trained ballet dancer, which at the time, to that doctor, he was like, oh, well, if you're in joint pain all the time, maybe you should stop dancing. I'm like, did you not hear that I dance 6 days a week, like 3 hours a day? This is not just like some little hobby that I can stop. It is my identity. And I was so mad at him, even though he might have been right. I probably should have stopped ballet. Like, really, he had a point. But I couldn't hear him because I didn't see where he was coming from. I didn't realize that he doesn't really get it. And I know he's trying to help. If I understood that, I might have listened to him and be like, okay, well, this is a much bigger deal. I don't know if I can just stop ballet, but can you tell me why you think that's the right idea? Is there something I could do? Could I ease up on it? Like, could work together. Instead, I was on the major defenses. Like, you don't get me. I'm not listening to anything you say.
It's a matter of syntax sometimes, right?
Yeah.
I mean, he could have changed the whole thing around, and maybe you would have, seen it in a different light. But it's hard to get rid of your, to say no to your passion, right? So I'm always very conscious of that. When somebody enjoys something, whether it's, CrossFit, and that takes a toll on the body, or they're a rower or they're a runner, that often, like you said, identifies them. So I think I always try to find a way that we can create an environment where they can perform that activity that they enjoy without wiping themselves out physically, and then it becomes physically then mentally.
Yeah.
I think that's really, really important. I find that a lot of patients, when they're turned down by like insurance companies to do a procedure, I always tell them to get like an appeal process, right? So a lot of patients don't know about the appeal process, and the same thing when I tell them, like you said before, if the doctor is not doing their job for you, they might be doing their job, but doing their job for you, it's okay to get another doctor. So in your experience, because people are always worried about changing doctors because they're afraid they're going to be judged when they go to another doctor because of their illness or because of their clinical presentation. So in your history of seeing doctors, can you say that you had more empathy from a male doctor versus a female doctor, or vice versa?
Ooh. I will say it kind of depends on what I'm seeing them for. Most of my negative experiences did happen with male doctors, but I actually don't know if that's really relevant. That actually might be coincidental, because I know that I hear all the time of people, of women with women being treated even worse. Mm-hmm. Because it's like, well, I'm like you, and therefore this isn't really an issue. I really do hear that a lot. So I don't want to give a firm opinion. I mean, I think it would kind of be ridiculous for me to give a firm opinion on it, honestly. But it is interesting how okay, so I'll give an example of, well, something I don't identify with. Well, I'm not saying this correctly. There is so much racial bias in medicine that even if you have like a Black patient and a Black doctor, that there's still a divide there. So it's similar in the, like a woman and a woman being in a patient-doctor relationship, and a man being in a doctor-patient relationship. I don't think it necessarily matters that one is like the other in some way. I think it's way more about the way the doctor was taught to be a doctor, not about what their race is or their gender is.
Do you think doctors can change?
I do. But it is a lot harder when they're older, because they've been set in their ways for so long, and they have found ways that this works for them. Like, they've gotten by. Unless there are major malpractice issues or just something clearly hasn't been working for them for a while, I imagine it's a lot harder to change, because that's true with any habit.
Right.
Like, what a lot of people have to keep in mind is that doctors they're doing their job. It is a job like a construction worker is doing their job, or a lawyer is doing their job. And so even though it can involve life and death, it's still someone's job. And if they have found a way to do their job that works, they get paid, they can live a life, like, they're going to continue to do that unless you convince them strongly otherwise that it is better another way. That I am making, a blanket statement there. Of course, there are older doctors that change, but my experience is that it's harder. So a big part of my advocacy efforts going forward will be to educate young doctors and med students. In fact, that's like a really big goal of mine with this new advocacy branch. It will be a long-term goal, but to gather as many insights from professionals and the community to determine what tools and maybe even courses should be created for doctors so that they can learn in med school or residency how to better connect with patients. And if you don't mind me doing a little plug, like that's what my TED Talk's about. And I did create a tool by accident that happens to work, but I'm not really promoting my tool. It's more the concept behind the tool. If you want to use the tool itself, that's awesome. Go ahead and run with it, make it your own. But I think there's a lot of work that can be done here. And if we get it in early in our medical system, I think we can have the most impact.
I think it's something that has to be taught, plain and simple. And you're right, get everybody while young. I think from docs who've been practicing for a long time, I'm going on 33 years now. It's a long time. So, the doc I work with, he's been practicing over 45 years. So I see a lot of general practitioners, a lot of docs turn to functional medicine because it's just a different model where you get the time to spend with the patient. Because I think that's what they always wanted to do was, just share the art of doctoring, right? Because there's an art to doctoring. And I think that's what they always wanted to do. So my question for you is, a 10th grade student, 11th grade student comes to you and says, hey, should I become a doctor? Knowing what you know, personally, professionally, how do you answer that?
That's fantastic. Also because I wanted to be a doctor and then decided right after undergrad, when I did all pre-med, I was like, you know what?
There's got to be a different way, right?
Never mind. I finished undergrad. I'm like applying for med school. But I would say being a doctor is the most honorable, or one of the most honorable careers one can take on. However, there are ways that it's being done now and ways that I believe it should be done. And I would probably give like some advice, just like if you're going to become a doctor, remember, I don't have a line ready, but remember that you will become an expert on the science and they will always be an expert on their experience.
I like that. You should have that one ready to go.
There you go. Look at me.
I like that one a lot. Yeah, it's really good. You just pulled that one right out. That's great.
Ooh.
You should, that's a good go-to. I like that.
Look, in a relationship, you have two sides to every story, two sides in any relationship. And both people are equal in every relationship. They just might see very differently. And so in a doctor-patient relationship, where are they equals? They're both experts in different aspects of what they're both are trying to accomplish. I'm going to always be an expert on my experience and what I'm feeling. I may not be an expert on describing it correctly because I don't have the scientific wherewithal. But that's really, if you want to silo the two roles, that's what they are. And so I would tell did you say like a 10-year-old or someone in 10th grade?
No, a 10th grader, 11th grader.
11th
grader. High school, ready to go.
Yeah, just remember, you will be an expert on the human body, but you will not be an expert on their body. So listen to what they have to say, because maybe not everything will be relevant, but you never know what's going to be. And that is a person, not a cadaver, not a body part. It is a whole person with a whole life. And I guess the additional thing I would say, and luckily this doesn't need to be told to as many doctors these days, thankfully, is that what goes up here affects all of this. Right. Brain affects body. So don't think it doesn't. It does.
Right.
Keep that in mind at all times.
Right. I agree. All right. So I have two more topics I want to touch on. Okay. So I want to touch on how gender and race plays a role in our current medicine and what you've seen experience-wise. And then if you can talk about Spoonies.
Ooh. Well, okay. So gender and race, oh, I mean, that's such a loaded topic.
It is a loaded topic, and let me tell you why. So I saw a doctor advertise, that they create a safe environment for the LGBTQ community. And I said to my daughter who lives in Brooklyn, why? I don't understand, why is this advertised? And she said, well, sometimes they don't feel safe. And I'm like, I don't understand, why would they not feel safe? I mean, you would feel safe in my office. Why is that? Who's not safe? And then she went on to explain to me how a lot of people in that community do not feel safe going a lot of times to doctors. So I was really blown by that, because I mean, it's obviously not the office that I have. Of course, pain's pain, and illness is illness, and sickness is sickness, and we're here to help. So what has been your experience in that? I mean, what have you seen? What is going on out there?
Okay.
Because I'm in a little pocket. I'm just in a small little pocket. So what is it that you're seeing? And it's a deep topic. It's a whole nother podcast. But
yeah, it's literally doing a whole podcast
right.
on actually a couple probably. So let's see, from a high level, when I think about issues from a high level, I really like analogies. Like, where else does this show up, this dynamic? Where else does it show up in life? And if we're talking about inequalities or biases, they also come down to, well, one of the things they come down to is ignorance, quite frankly. And then the other is empathy or lack thereof. Like I said before, the people don't have the mindset of, I understand that I don't understand. They're like, I don't understand this, so I'm just going to deal with it however I deal, and just assume that it'll be fine by you. So that goes for a situation where a man is going to treat a woman like he would want to be treated, or another man might want to be treated, because he doesn't understand what the woman's experiencing. So he's going to make these assumptions and not actually try and see from her perspective, or actually what he should be doing, which is asking her about her perspective and not making assumptions at all. And that's true also from a racial or religious standpoint. Like, if you don't know what their experience is, and you should ask them. And actually, I'm contradicting myself again. Ask them, period. So don't make any assumptions. Ask them what it is that they want to, I guess, what their expectations are and what they're looking at, and let them speak their truth. I'm giving a lecture to doctors. Mm-hmm. I apologize. I guess this, what's more important is you really are asking, like, what's the problem, right? Why do these issues exist? Why do some people not feel safe going to their doctors? And it's because there are assumptions being made. There are prejudices. There are biases. And a lot of the time people aren't even aware of them. I mean, that's why not why, but that's a big thing that's come out of the Black Lives Matter movement. And actually today is the year anniversary since George Floyd's murder, actually. What we have realized as someone who is white, that whether I like it or not, there is so much racism that is involved in my world, and myself as well, because that's like, I don't know any better. And that's the world that I grew up in. And so in some ways you could say that from doctors, and I was alluding to this before, Black doctors are exactly the same. I've listened to and read so many accounts of women in particular with gastrointestinal and gynecological issues, where they thought that a Black woman doctor would resonate with them more, and they didn't at all. And sometimes they were the worst. I mean, you take every which one, but I'm saying it's amazing how even if you are part of that community, that it's still the doctor hat they're wearing. They're not wearing the Black woman hat. They're wearing the doctor hat. Right. So look, I'd like to say at the end of the day, as I said, my theory is that if we look at all of these issues from the standpoint of relationships, from empathy and empowerment of each side to speak up, and not just speak up, but be in a relationship, that I really believe that has the ability to fundamentally solve so many of these issues that we have today, including those where people don't feel safe going to see their physicians. So yeah, I can go into the nitty gritty, but I'm trying to keep it.
Right. No, great. No, that was a great reply. No, it was on the, it was a good, very good reply. I liked it. And now we're talking about relationships. Let's talk about Spoonies.
Spoonies, also fun, big topic. So for those who don't know, Spoonies, like hashtag Spoonies, if you look up, like literally hashtag spoon and then IES, it's this whole, we're a worldwide community of people who have identified with what is now known as the spoon theory. And I may not recount this correctly exactly, but I think in like 2007, Christine Miserandino wrote this blog post. She had this like lupus blog where she'd write about her experience. And she said one day that she was at the diner with her best friend in college, and they'd been best friends for years. She'd watched her friend with lupus not being able to go out sometimes, getting really tired. The friend dealt with it. And she was like, oh, it's okay. Whatever. I love her. I'll handle it. Apparently in this diner one day, her friend finally asked her, what is it like to have lupus? Like, I don't really understand. And Christine was surprised because she figured that her friend must have done research on lupus. At this point, they've been friends forever. And I continue with, like, you say you're always tired and you can't do certain things, but you look healthy. I don't really understand. And so Christine took this as an opportunity to finally get through to her, but then she realized greater than that, to people, what the experience is like. And so she grabbed a bunch of spoons from tables at the diner. I think it was 12 spoons. And she said, okay, this is all the energy I have in a day, like is measured in these 12 spoons. And so with different activities in the day, they cost a spoon. And her friend was like, oh, I want, let's get another few spoons from this table. And she said, no, you have 12 spoons. That's it. No more. And so she saw her friend's face change, and immediately it was like, oh, this is going to resonate. She realizes that there is a finite amount of something here. And so her friend said, okay, so it's like this spoon getting ready for the day. Is this spoon like the first part of your work day? I don't know, like she was trying to categorize the amount of energy in a very broad way. And Christine said, no, this spoon is getting out of bed. This spoon is brushing my teeth. Another spoon is putting my clothes on. Another spoon is making coffee. And you could see how like halfway through the day, 12 spoons gone. And you can't get any more. And so every single day of a Spoonie's life, they have to think about their spoons that they have, these 12 spoons they have at their disposal, and how they're going to use them. Because once they run out, they run out. And that means a Spoonie sometimes can't cook dinner because they anticipate the fact that they're going to need to cook, or by the time they're done cooking, they won't have the energy to eat. They won't have the energy to clean up, or then maybe to drive and pick up their kid from somewhere. Spoonies have to spend their days planning their energy out because they know it will run out. And energy comes in many different forms. It's like, well, now thanks to COVID, unfortunately, I think most people in America understand what fatigue actually means. It does not mean you're tired. It means like you do not have the energy to move, to speak, to breathe. It's being fatigued is really crazy. I mean, it is not being tired. It is not brain fog even. Brain fog and sleepiness can happen with fatigue, but they are all very separate things. So sorry, I'm telling like the whole story of the spoon theory, but
that's good though.
I reread actually the blog post somewhat recently. I hadn't read it in like 5 years. And I'm really glad that I did.
Perfect timing then.
Yeah, it was perfect timing. So I think I got it right this time.
Yeah, that's great.
Yeah. So this exploded. This blog went seriously viral, clearly. And now people around the world with chronic diseases and disabilities, especially those that have invisible illnesses and disabilities, resonate with this idea of the spoon theory, because it was the first time someone put in like a tangible, like made this experience tangible and comprehensible to people who don't have that experience. I don't know if I identify as a spoonie, if I'm going to be honest. Okay. There are days when I am a spoonie. There are days when I really have to be aware of my spoons and think about how I'm going to plan my day. But I'm happy to say that I've managed my health well enough up into this point where it's not so much spoons for me. It's just awareness of what I can or cannot or should not realistically be doing. For instance, I'm on this bouncy ball, right? I know that if I spend an hour in my chair, as much as I love my chair, and it's very noisy, that my joints will lock up and it will be very painful. So maybe it's not an energy spoon, but it's a spoon in that this is a way that I compensate. This is a way that I manage my life. And so, yeah, I have to think about that all the time. So in some ways you could say I'm a spoonie like that. It's not so much energy as it is I can never not be aware of the fact that I'm in chronic pain.
Right.
Yeah.
No, great share. And I think a lot of people really resonate with that. And I think knowing what you can and cannot do is great. Knowing limitations is great. Knowing that if you are going to do something, what to do afterwards is really important. And I explained to patients, I said, listen, go have fun. I'll see you when you return, and we'll just take care of whatever flares up if something flares up, right? Yeah. So, at least they can rest easy knowing that, there's something to do afterwards. So I think it's really important. So no, that was a wonderful share. So as we wind up, if you can, tell about where we can get your TED Talk, right? And how they get to that. B, if you can share, again, is there a website for the new venture yet? Like how people can get to it?
Yeah, everyone should go to invisiblenotbroken.com because that is our current network page. That's where the Humancare Podcast is, the original Invisible Not Broken podcast. We also have Sex and Chronic Illness, Explicitly Sick. And I say go there because that will eventually become whatever the new site is.
Excellent.
So it would like redirect or something. Okay. So, that's invisiblenotbroken.com. And we also have a Facebook page and a Facebook group that I really love. Our Invisible Not Broken Facebook group is, the Spoonie community. And it's a great community. The TED Talk, so I can't, maybe you can post the URL, but first of all, I think if you Google Eva Minkoff TED Talk, it comes up. Right. But also the title is, and I'm aware this is a ballsy title, but it is 5 minutes to fix our broken healthcare system. So if you Google 5 minutes to fix our broken healthcare system, I will come up.
Excellent. I can't thank you enough tonight. And what one thought would you like to leave us with tonight to help that chronic pain patient?
Remember that you are human and all the good and bad that comes with that. And also remember that everyone around you is also just human. And my alarm's going off, which is a nice outro music.
Nice timing.
Yes.
Excellent. Absolutely beautiful. Again, thank you very much for spending some time with us tonight. I really appreciate it. And you know what? I hope to do this again soon with you.
I would love to. This was an absolute honor and very enjoyable for me.
Great. Thanks. Hold on one sec. All right, everybody. We'll see you soon.
Bye.